This is Dr. P here. I'm here with David. I'm very thankful that he's allowing us to do a little educational video on what some swelling in the knee might look like. Our knees produce fluid. All our joints produce fluid, lubricating fluid called synovial fluid to lubricate it. It's a very viscous, meaning kind of thick and very lubricating, slippery fluid. Now, when a joint gets inflamed, inflammation, itis means inflammation, so arthritis is technically inflammation of a joint. When a joint gets inflamed, it tends to produce more fluid. Just like when your eye gets irritated and inflamed, it produces tears to kind of wash that irritant out. It's kind of the same thing. If somebody has arthritis, or they have a cartilage tear, a meniscus tear, or they've injured their knee, or they have overdoing it, they're just kind of overdoing it, their knee might get a little inflamed and it might produce more fluid. How can we see that on a physical exam? On a physical exam, I'm going to look at his left knee and his right knee, and to me, just looking, and if you look between the left knee, which actually is a year out from surgery, and it was much more swollen a year ago, and then you look at his right knee, you can see there's more swelling right here in this area here. This is called the suprapatellar pouch. So the patella is the kneecap, and above the kneecap, there's kind of a hollow area, not really hollow, but an area where fluid can collect between this quadriceps tendon and the thigh bone down there. If you look here, you can see it's spongy, and there's a lot of fluid there. So I'd call that a 1+ effusion. It's not huge, it's not tense. 1+, 2+ would be quite a bit more, and then 3+ is tense, super swollen. He'd probably be complaining about pain. The left knee obviously has much less swelling. You can see almost an indentation here as opposed to a pooching out here. Now, is there any fluid in here? There's a little excess, probably a little bit more than normal. You can see that little, what we call a fluid wave, but it's certainly nowhere near as much as this knee. They both have arthritis in them. This one actually had knee repair, not knee replacement, done with it, so it's expected to be better, but it still has some arthritis in it. This has arthritis in it, but it hasn't ever really been treated, and it's a bit more swollen than this one, which has been treated. Either way though, the stronger we can make these muscles here, your muscles are your main shock absorber. So the stronger your muscles are, the more force they're gonna absorb, and the less force is gonna go across that damaged joint. And so that's gonna take some of the pressure off. I'm gonna tell him to really work hard on strengthening these muscles, and all the muscles in the entire leg. Even the calves help protect the knee, even his hips. This muscle here, this thigh, was about a 1/2 centimeter smaller than this one. We really wanna get these maybe 1 centimeter or 2 bigger, and a lot more muscle mass will take some of the pressure off here, and then hopefully the knees will be less irritated, and the less irritated they are, the less fluid they're gonna produce, and the less swelling, the less stiffness, less pain. There you have it regarding swelling and quote-unquote effusion in the knees. Thank you.